Hi, everyone. I'm Dr. Bojana Yankovic-Weatherly. I'm a board-certified internal medicine physician and integrative medicine physician. And I practice in my own practice in this comprehensive way where we support our patients by providing evidence-based conventional modalities and innovative modalities. But at the same time, we really focus on nutrition, lifestyle, identifying root causes of conditions, and really supporting our patients in a very integrative way. Our goal is to work on prevention and really focus on prevention as much as possible because preventing a disease is much easier than treating a disease once it has already started to develop. And today, the topic that we're going to be focusing on is cardiovascular disease. And what are the factors that come into play when it comes to preventing cardiovascular disease, when it comes to identifying people who might be at a higher risk?
Yeah. Today we will be talking about like why most heart attacks are totally preventable and like no one talks about. So
Mhm.
Bayana, could you like talk, go like into details? So why? Because for example, from the doctors, I know that first of all, heart attacks, they higher than like a cancer right now in the country, and a lot of people they actually die from heart attacks. And something that we are working right now in terms of like reversing like the age of the organs, but apparently like we didn't succeed yet. I mean, like there is a genetic engineering when we're trying to grow hearts and a laboratory. If I'm correct, we didn't succeed it yet. So we still, for example, in Germany, they do heart transplant, which is quite expensive and like it's not so easy to get. But basically, as we know, heart, it's an organ that basically like it's a ticking clock. It's what it meant to, like live on this planet, like sustain the life of this body, it will. And sometimes, like it's just stopped working. It's just, that's why like people, when they go through checkups, they have like a special monitor and they can measure actually the age of the heart and like how it's working. And there is a misconception, again, I've heard from the doctors, is that, oh, like I'm climbing the mountains, I'm like doing all of the sport activities, it means I'm gonna live up to 100. But it's not. It's like if your heart, like is not young and it's basically like it's supposed to, let's say, function for like 80, 70 years, it will. But then, like at this point of our life, we can talk only about heart transplant.
Mhm. So so heart disease, you mentioned it's heart disease is the number one killer, right, in men and
Yeah.
women, right? We often think about breast cancer for women, for example, but heart disease is in women, in fact, the number one killer as well. And we can get a little bit into how menopause increases cardiovascular risk in women specifically, and why, while women have hormones, at reproductive levels, right? Premenopause, this is protective for heart disease, which is why women on average develop heart disease later than men. But there are many other factors at play. So, really, I want to start by talking about metabolic health because metabolic health and metabolic syndrome in particular, and I'll define that in just a second, is a risk factor for mortality. It's a risk factor for cardiovascular disease. It's a risk factor for type 2 diabetes. So, what is metabolic syndrome? So, in medicine, we have a great way of defining these disease states, right? But we don't necessarily do as well at defining health, right? So for metabolic syndrome, we have these definitions. What is metabolic syndrome? But what is really optimal metabolic health? So let's first focus on the metabolic syndrome component. So for a person to be diagnosed with that, which again is a high risk factor for developing heart disease down the road, they have to have three of the following criteria. They have to have elevated blood sugar levels, elevated fasting blood glucose. They have to have low HDL, which is high density lipoprotein. They have to have high triglycerides. elevated waist circumference, and elevated blood pressure. And they have to have only 3 out of those 5 criteria. Now, there are many other markers that we use in clinical practice routinely that also correlate with this metabolic syndrome. And what it essentially means, what's essentially occurring there, is that our blood sugar levels are going up. We are requiring higher levels of insulin. So our body is now having to produce more insulin in order to utilize that blood sugar and store it. And then our body is also producing more inflammatory markers, these inflammatory messengers. And one of the ways to capture that on labs is by checking a high sensitivity CRP, C-reactive protein. And again, this is one of the early markers that indicates a risk, a heightened risk for cardiovascular disease. And then we have other markers like hemoglobin A1C, which is our 3-month marker of blood glucose levels. And if that's elevated, that also indicates a higher risk of developing cardiovascular disease down the road. And it's not a process that occurs overnight. And so this is something that really takes years and decades to accumulate, right? And so one of the things that we are becoming better at is identifying earlier on these risk factors and acting on them. The problem is that such a high proportion of our population has metabolic syndrome and has these risk factors. So it's really difficult to then reverse and to keep up with this. And we'll talk about how we can do this. But it's really important as the number one thing is really to identify, and I do this for all of my adult patients, to identify, does one have the risk factors? And one of the ways to do so is by doing labs. So we'll do a comprehensive lipid panel. We'll check for some additional markers like apolipoprotein B, lipoprotein little a, which I'm sure your audience has heard about in this context. It's not something that has always been routinely done. So they are markers that you're not necessarily going to get if you get your standard labs, but something to consider asking for to further assess that risk. And then we also worry about inflammatory markers. We want to see that insulin level. Is that fasting insulin elevated? Is fasting blood glucose elevated? What does the lipid profile look like? Blood pressure, because all of these things ultimately increase the risk of cardiovascular disease. And what this process involves is it involves damage to the inner lining of the blood vessels. It involves inflammation and recruiting of the immune system into that space. It involves, as we all know, plaque formation. And that plaque can become unstable and eventually it can cause blockages. And that ultimately causes heart attacks or strokes. And unfortunately, a number of heart attacks, the first presentation is death, because sometimes people may not necessarily go through symptoms over time that might signal to them to go see their doctor. And so this is why it's really important to be able to identify these markers earlier on. And again, this is just part of the picture. There are other components too, but to really identify this early on so that we can intervene and so that we can mitigate that risk. Another big thing is family history. So especially for my patients where I know that their relatives have had early heart attacks, and especially here we're looking at first degree relatives, but others as well, if they've had early heart attacks, this is the patient that I'm going to be particularly worried about. Because again, there's a genetic component to this as well. And by the way, over 50% of our cholesterol, our lipid panel profile is dependent on our genetics. So while there are many things that we can adjust and change, and we'll talk about that, there's also this component that right now we can't re-engineer our genes to change that. And so it's really important to understand that while there are some modifiable things and some things we can absolutely be proactive on and work on, there's also this genetic component that we simply can't avoid if those are genes that we're given. Other factors like the obvious ones, which again, I'm sure in your audience, this is a very proactive audience, but smoking, of course, we have to mention, sedentary lifestyle. And this is like, even for those of us who are active, even for those of us who are so aware of that, and we exercise every single day, the rest of the time we're sedentary because our work is mostly sedentary.
Yeah.
And so, really trying to get up every hour, every couple of hours. I know this is so impractical. Have a standing desk. Have that movement, have that zone 2 exercise, have the zone 5, have different degrees of challenging ourselves is really, really important. And I think you mentioned something about people who, maybe they have a high exercise tolerance, and despite that, something still happens. Yes, exercise is a great way to mitigate that risk. But if you still have that inflammation, if you still have that lipid panel that you haven't dealt with, if you have insulin resistance despite your exercise, which still can happen because not everything is modifiable, you still could be at risk. So we still should be addressing things in this very proactive way, but at the same time recognize that not everything can be solved with lifestyle and nutrition. A lot of things can, but not everything can. And so then really turn to uh, pharmaceutical support, supplemental support in some cases as well, other modalities as well. We often don't talk about stress as a risk factor. Oh, we do. We mention it, but then it's like, oh yeah, okay, stress. What are we going to do? A lot of people that I see, feel that, well, I don't have time to meditate. I'm really not a good meditator. I don't, and so this is always part of my discussions with my patients. What are your stressors? How are you coping with stress? Are you seeing a therapist? Are you seeing a coach? Do you have a support system? Do you have a good community? Because again, this factors in, and we know this, people who have stronger social connections live longer. And so it makes sense that this is something that supports our cardiovascular system. We know that if we are under higher stress, we are also likely having higher blood pressure. We are releasing those chemicals in the body that predispose us again to ultimately damaging our blood vessels down the road. And so this is something that's also very important to address again in that setting of exercise and nutrition, but really finding a way. It could be meditation. It could be different forms of engaging in mind body exercises. If somebody really has a hard time sitting still and meditating, there are walking meditations. There are other things that they can engage in that still engages their mind and body, and really helps them to find that inner peace and to support themselves. There are beautiful breathing exercises that we can go into that can help with this as well, that really don't take a long time at all. But
So, basically, like for women, like to be proactive, like, I mean, for those ones who want to be proactive, like with their health.
Mhm,
So, I mean, number one would be is to try to reduce the stress by
mhm,
meditation or like some other techniques that works for them. Then
mhm,
the number two would be exercise. But I mean, again, as we discussed, I mean, lifestyle is not 100% guarantee.
mhm.
Then the number three would be to do the right blood panel with like those biomarkers, the one you mentioned about.
Yes.
Do we miss anything? Like what else, like people
Yes,
should,
there's more.
yeah.
Yeah, there's more. So, in terms of nutrition, right? So, we know that ultra processed food, which is all around us, and even sometimes, health foods can be ultra processed foods, right? And cause
Mhm.
increased inflammation. So, being really aware of what we're putting in our body. This is directly affecting our inflammatory markers. I see this all the time. It's affecting our inflammatory markers, increased saturated fat, increased red meat, fried, ultra processed food. They do have a strong impact on our lipid markers, such as our LDL, ApoB, and so forth. We also see that low fiber diets do the same thing. So we have to up our fiber. And less than 10% of adult US population consumes enough fruit and vegetables. And this is our big source of fiber. So less than 10% of us really consume what we should be consuming in terms of that. So it's very, very important to hit those goals. And again, different people may have slightly different tolerances when it comes to fiber because of gastrointestinal issues and so on. But again, this is where either working with a nutritionist or dietitian can be really helpful, tracking macronutrients, and really kind of being aware of what we're consuming and trying to stay in that ballpark. When it comes to tracking of those things, I really don't think that for most people it's practical to constantly be tracking. And also, we don't want to encourage, disordered eating or too much kind of obsession over that. But I think it's really healthy to track, and even better, while you're tracking, put on a continuous glucose monitor and see what spikes you. And people don't have to be doing this I mean, unless again, they have diabetes that's poorly controlled and so forth. But if they're a generally healthy individual who's looking to prevent, and maybe they have some risk factors, they don't have to do this month after month after month. I sometimes will have patients do 2 weeks at a time or a month at a time. Let's track your dietary log. Let's track your exercise and your continuous glucose monitor and see what spikes you. And we really do see, sometimes individuals, they'll consume exactly the same meal, but it might be either a different time of day, it might be under different stress conditions. And guess what? Blood glucose levels can shoot up. Some people really don't tolerate certain fruits without the context of movement, without the context of fiber.
I actually did a very interesting experiment myself. So I was wearing a glucose monitor, and I was wearing it in New York, and then I was wearing it in some bars.
Mm-hmm.
So, and in some bars, I mean, it's a French island, they drink
Yeah.
wine, they eat croissants, like all the stuff. Surprisingly, I was even triggering my glucose monitor, but it wasn't going up. I think it's because of the stress level and like the environment being close to the ocean. It's all kind of like affected.
Yes. So wait, so your levels were higher in New York because of the stress you think than compared to St. Bart's?
Yeah, and in New York, I was trying to eat healthier, like
Mhm.
healthy. Like I was very, very mindful. And in some bars, I was like drinking wine, eating croissants, like really trying to trigger my glucose level, but it never was like crazy up.
Yeah, yeah. I hear this often from people when they go on vacation. And they'll tell me, oh, I had a more liberal diet and I indulged a little more. But maybe they're walking more, they're less stressed, they're probably sleeping better. The quality of food also often, when we talk about Europe, especially, certainly affects, and I hear this from even patients who are gluten sensitive, not celiac, because they don't want to ever consume gluten, but gluten sensitive who go to France and they consume croissants and baguettes. Oftentimes they feel completely fine, come back to the US, there's no way they can reintroduce it. All of a sudden, there's bloating, there's change in bowel patterns, and so on.